Good afternoon, everybody. Welcome to this ENN-hosted webinar on strengthening the humanitarian and development nexus for nutrition. We're so pleased that despite the current COVID-19 difficulties, that we can see so many of you have joined us for this session today. And somewhat sadly, I suppose it's fair to reflect that there's no better time to be discussing how we can strengthen humanitarian and development systems. My name's Carmel Dolan, and I am one of ENN's technical directors, and I will be facilitating this webinar today. I'm also joined by a fellow ENN technical director, Jeremy Shoham, and as well by Chris Leather, who is a consultant at ENN and has worked on this humanitarian development nexus. We've divided the agenda into 5 parts. I'm going to cover a little bit of the background and scene setting that underpins this work on the humanitarian development nexus. That's going to be followed by Jeremy, who's going to share what we've learned about nutrition policies and programming in protracted crisis contexts. And then after Jeremy, Chris will talk us through some of the financing arrangements to strengthen the nexus that we've picked up on and have thought about through the process of this work. And Chris is then going to take us through the next step and our recommendations that we'd like to share with you. So first of all, I wanted just to reflect for you all on why ENN has undertaken this work. And I think it will perhaps not be a surprise for many of you to know that bridging the divide between humanitarian and development systems is not really a new concern. Indeed, it's been a concern that's been around for many decades, and it's had various titles to describe it. And sometimes it's been more popular than others. But at the moment, and more recently, it has received renewed emphasis. And this particularly was noticeable after the World Humanitarian Summit that gave rise to what many of you will know as the Grand Bargain and the UN New Ways of Working. And this renewed emphasis really has come out of the recognition that so many of the crises in the world today are indeed protracted, and they are more complex in a number of ways as well. And because of these features, it does demand that we increase our collaborative efforts across the humanitarian and development space, and in order to maximize resources. And it's worth bearing in mind as well that there have been a number of publications in recent years that have really set out how difficult it will be for us to achieve sustainable development goals where protracted crises undermine the targets set within our SDGs. So in ENN, we wanted to look more closely at the humanitarian development nexus, HDN, but through a nutrition lens. And we wanted to really set out and try and understand what the wider policy shifts really mean for programming on the ground. So the work we're going to describe to you today is built on 2 main objectives. First of all, in keeping with our typical approach to knowledge management and learning in ENN, we wanted to identify examples of good practice within countries around the nexus for nutrition, and to share that as widely as possible. And this webinar is one example of how we go about sharing that. But we also wanted, through this work, to identify ways in which we believe the humanitarian development nexus for nutrition could be strengthened, so that we're contributing towards accelerating progress in reducing malnutrition. And we're going to come to that in the webinar when we reflect on the next steps and recommendations later on. I want to also reflect that we've been so fortunate through this work to receive financing from 2 major donors, so from Irish Aid and from DFID. And as many of you will know, these are 2 donors who have been at the forefront of thinking around resilience and around the humanitarian development nexus. So we're very grateful for their support for this work. So how have we approached it? Well, we carried out 4 country case studies. So Ethiopia, Kenya, Somalia, and Yemen. And we deliberately chose these to reflect a very broad spectrum of fragility and protracted crisis contexts. In 3 of the countries, Ethiopia, Kenya, and Somalia, we were fortunate enough to be able to go into the countries and work at both the national and the subnational level with a whole range of actors, national actors, state actors, development and humanitarian partners. For the Yemen case study, which Chris mainly led on, this had to be done remotely because it just wasn't possible due to security concerns to be in Yemen at the time we were carrying out the work. But Chris was able to spend time with key informants at the Sun Global Gathering in November of last year and develop the case study on that basis. I want to also say that we, in the process of the country case studies, we worked very closely indeed with the Global Nutrition Cluster and indeed in all of these countries with the country nutrition cluster coordinators. And I think some of you are on this webinar, and it's going to be interesting to hear your reflections a bit later. And to also add, we worked with government actors as closely as possible. And I think Somalia is a really good example of that, where we were able to work with the federal government of Somalia and the Ministry of Health, Sun Focal Point, who co-authored the case study that came out of that work. We also carried out a desk review, which was really looking at a number of key frameworks and documents, and that helped inform a synthesis report that we pulled together. And that really is what we're basing a lot of this webinar presentation on, is our synthesis of the findings from the 4 country case studies and the desk-based review. And just to mention that the synthesis and the case studies will be available on our website, and you can see at the bottom of this slide how you can access some of these resources. They're not all up yet, but they soon will be. So why is it important to focus on protracted crisis contexts? Well, I think, first of all, it's really important just to think about the sheer number of the world's population who are living in fragile settings. In 2016, it was estimated this is about 1.8 billion of the world's population, or just under a quarter, living in a whole range of fragile contexts. But what is really alarming is that this is predicted to grow to around 2.3 billion by 2030. So very alarming numbers, people experiencing fragility on a day-to-day basis. The forthcoming Global Nutrition Report, which I think many of you will be pleased to hear, will be published in the May of this year. And within that, it is looked at undernutrition within both fragile and extremely fragile contexts, and has found a disproportionately high burden of some forms of undernutrition, and in many instances, stubborn levels of wasting, stunting, and indeed concurrent wasting and stunting in those populations, as well as anemia. And though this is compared to averages for developing countries, so we have high levels of undernutrition in these populations. And these forms of undernutrition are certainly made worse by exposure to what we see as these chronic structural deficits that exist in many protracted crises. So this is where your key delivery systems are eroded, or in some instances almost absent. So this is when we think about the health system, education, water structures, social protection, and so forth. So these chronic structural deficits exacerbate already high levels of malnutrition, and particularly undernutrition. And then on top of that, and this is certainly the case in the case studies that we looked at, these same populations are also exposed to periodic or repeated acute shocks. And these can come in many, many different forms, be it floods, droughts, an upsurge in conflict, economic declines, and so forth. But what this does is to compound an already worrying level of nutrition insecurity. So it increases the population's nutrition vulnerability. So before I hand over to Jeremy, I just wanted to pop up this slide because it's really important, and we're going to come to this a lot more in this webinar, to think about the aid resource flows into these fragile contexts. And this slide is just looking at data that the OECD published in 2018. And what it does is it shows us the proportion of humanitarian aid relative to official development assistance in extremely fragile contexts. And if you look at the dark blue part of that pie chart, the 47%, that is the resource allocation, humanitarian aid resource allocation. You can see how much it dominates international assistance in these extremely fragile contexts. And actually, if one looks at all protracted crises, you see that 90% of all humanitarian aid is going into these contexts where you have repeated year in, year out emergencies. And another feature of the humanitarian aid system to be aware of, and we're going to come back to this a little bit later in the webinar, is that when we think about humanitarian appeals, they now last on average 7 years. So year after year of repeated humanitarian appeals being required. And this is particularly the case in these protracted and fragile context settings. And added to this, in the last 10 years, according to OCHA data, one can see an exponential increase over the last decade of something in the order of 400% in the size of the appeals that are a feature of the humanitarian response. Okay, so I'm now going to hand over to Jeremy, who's going to talk to us about what we learned through this case study work about the policies and programs that exist within protracted crisis context. So over to you, Jeremy.
Thank you, Carmel. We looked at policies, plans and frameworks in these 4 countries to try and understand how these were enabling or constraining a stronger humanitarian development nexus and the impact that that has on nutrition programming, and in particular programming which prevents malnutrition, because a central hypothesis, if you like, of this work has been that in fragile contexts, what you really want to achieve is maintain and improve nutritional status, but particularly maintain it in the face of shocks, whatever those shocks may be. And out of the 4 countries, Kenya was very much, it was our first study, and it was very much a silver standard, if not a gold standard, in the way government has managed to strengthen over probably 7 or 8 years the linkages between humanitarian and development work, and in fact move away from humanitarianism, which was a recurrent phenomena in the arid lands in the north of Kenya. And they've done this in many ways. First of all, they had a resilience framework, which is called the Ending Drought Emergency Framework, under which all actors would work and align. And in the period between 2011 and 2017, when the next serious drought occurred in the north, there'd been a great deal of investment in resilience building in the fragile northern areas. And at the same time, when severe drought did hit in 2017, the government were able to scale up services and existing systems to cover emergency needs without recourse to humanitarian support or very limited humanitarian support. And they did this through their Hunger Safety Net program, a form of social protection, as well as their CMAM, their treatment of acute malnutrition, which they were able to surge. And now I think Kenya's experience has also been helped very much by their devolved government, which meant that counties in Kenya have their own budgets. And in between these 2 years of severe drought, 2011 and 17, counties have been able to invest in resilience projects and build up the nutrition resilience or nutrition security of their populations. So in a way, Kenya has, I think the common vernacular now is it has right-sized humanitarianism. This is in contrast, though, to the other 3 countries, where over the last 6-7 years, we have seen quite rapidly increasing humanitarian response plans and programs. And as a result of that, governments and other stakeholders, development partners, have begun to develop resilience frameworks. So we're talking about Somalia, Ethiopia, and Yemen. That has been a response to the realization that year-on-year humanitarian response programming doesn't really make a great deal of sense because you're not improving the situation, you're not building anything. These resilience frameworks in Ethiopia and Yemen have largely been led by the UN, and yet they're still separate from the humanitarian response plans and the national development plans. In Somalia, the RRF, the Recovery and Resilience Framework, has been negotiated in a rather different way. It's much more government-owned, but it still has the same problem in that it's not really linked to development partners and the humanitarian stakeholders who are also very active in Somalia. One of the other elements or aspects of policies and frameworks that we were very aware of in doing this work was the so-called collective outcomes, which I think Carmel mentioned in her introduction. And this is part of the new ways of working arising out of the Grand Bargain and Humanitarian Summit in Istanbul 2016. And the idea here really is for humanitarian and development systems to combine goals and outcomes and to have the same shared goals and outcomes. What we found, though, looking at these collective outcomes, was that they lacked granularity and there was no real accountability for who was to deliver on them. And in general, I think the sense was that progress in terms of these collective outcomes was limited. Another interesting finding, I think, for us was that where there are humanitarian response plans and resilience plans and frameworks, these often overlap and there's lack of clarity about what type of program goes where or who owns those plans. And that was confusing for many stakeholders. And generally, we found that governments lack capacity to identify the needs and processes for nutrition security building in these fragile contexts. And that efforts to build nutrition security are often crowded out by humanitarian actors and humanitarian resources. So, as I said, we adopted a nutrition programming lens to look at HDN, to look at the humanitarian development nexus. And as Carmel mentioned, resilience is a common term used in this space. The term nutrition resilience is also coined by some people, although there isn't a great deal of clarity about what that means. But as I said earlier on, what we're really interested in here is ensuring that when there is a shock, nutrition status does not decline. And hence, we've reverted to a term that's been around for a long, long time, nutrition security, the definition of which is up there. But as you can see, it is maintaining nutrition status in the context of shocks, natural or man-made. So we asked ourselves the question, what is good nutrition security practice in these fragile contexts? And, you know, as with so many things, there are many ways you can divide up the cake, but we've chosen really to think about two different types of program in these contexts. And we'll become a bit more granular as I go on. First of all, longer term, longer lasting programs focused on the underlying and basic causes of undernutrition and the risks and vulnerabilities populations are exposed to in protracted crisis. So in our mind, that really speaks to preventing malnutrition. And the second type of programming is immediate life-saving interventions, generally for children, but not exclusively, who are wasted or sick or at immediate risk. And the kinds of programs we're talking about there are evidence treatment interventions or immediate food and cash assistance to make up for an acute shortage. These kind of interventions are often backed or supported by early warning systems and contingency planning. So, next question for us really, what do prevention programs in these fragile contexts look like? What did we find out from our case studies? Okay, so this is where I think it really gets interesting for us, because what we're seeing in fragile, protracted crisis contexts is so-called prevention programming becoming mainstreamed into humanitarian programming with short-term funding and little evidence of impact or programs being consolidated over time. We're seeing these programs as a sort of stop-start nutrition interventions which begin with each new humanitarian cycle, and then there's a gap for agencies to reapply for funding, and it goes on every year in the same cycle. And with all the very significant transaction costs that stop starting entails. We're also seeing, as Carmel mentioned, an ever-increasing number of humanitarian response plan caseloads. And many of that caseload are not affected by recent shocks, but they just happen to be in highly vulnerable areas. So they're not affected by proximate shocks. They're included in the caseload, even their administrative area may have not been subjected to a shock in the last year. We also found or saw that longer-term development resources, of which are considerable in all the countries we looked at, are targeted outside the fragile areas of the country. We'll come back to that, and Chris will talk about that some more. So our thinking really has been to try to develop a framework for programming, which would help clarify this blurring, if you like, of program approaches. And Carmel has just put up our first attempt at a framework for this. Now, I think there are lots of caveats with this, and it's definitely a work in progress. The aim of trying to formulate a framework is to help decide which programs go where, with which funding, and who is responsible for those programs. In the synthesis report, we've attempted to do this in a bit more detail and to flesh this out. But if you look at what's on the screen there, you can see that the shaded boxes are really where we need a better architecture to implement programs. The non-shaded areas, which are basically the humanitarian response, we've made enormous progress in recent years in our ability to deliver humanitarian response for nutrition, not in small measure due to the advent of the cluster in 2004. We think that this kind of framework is going to help ensure that those poorly designed short-term prevention programs, which are currently included in HRPs, move outside of the HRPs and are taken on by other actors. But what is needed is clarity around what those programs look like. Our framework basically cross-references immediate and underlying causes of malnutrition with populations affected by acute shock versus those who are structurally and chronically vulnerable. Clearly, when you're doing this kind of framework formulation, you need to consider the causes of malnutrition. This framework would also help us see where current investments are being made and where it's necessary to recalibrate humanitarian response, so you only focus on life-saving actions and reducing the risk from proximate shocks. This would be a very interesting exercise to do, not just for nutrition, but for all sectors. We're very aware that over the last 10 years, this phenomena, this resilience creep, has happened in many, many countries which have had consecutive humanitarian response plans. It would be very interesting to see if that's the same for other sectors. One final thing to say about this framework is that to some extent, the framework will be country specific. So if you take a program like health system strengthening, which up until a few years ago wasn't really in humanitarian response plans, as far as we can see. But if you see that kind of program, in some contexts, it could well be life-saving and a response to acute needs, whereas in another context, it might not be so. So like I said, this is a work in progress, but the principle is what's important. It's to distinguish programming and to clarify where programming fits and where the resources should come from. So in order to achieve this kind of right-sizing of humanitarianism, you need coordination. And what we saw with regard to coordination led us to conclude that in all case study countries, the fora for humanitarian and development stakeholders to come together are very limited. As I've said before, these ideas of collective outcomes for humanitarian and development actors and programmers have been too high level so far and lack detail and therefore accountability. Perhaps the most important message to take away is that there is no clear responsibility for those populations caught in chronic or protracted crisis. They seem to fall between the cracks in the architecture in terms of receiving appropriate support. The clusters were not set up for these types of populations. So there's no meaningful coordination or accountability around them and provision for these groups. Thinking back to Carmel's last point, this population is significant. The size of this population is significant. I think she quoted a figure of 1.8 million in fragile contexts. So many of those will be in this kind of chronic emergency limbo, if you like. And I think the projection was that by 2030, that will be 2.3 billion. So I'm going to stop there and let Chris take over.
Thanks very much. So I'll talk about what we found in terms of financing arrangements. I'll talk a little bit about what we were understanding to be good practice in financing for nutrition in these contexts, what we found in terms of current practice, and highlighting one or two issues around the barriers to improving financing for nutrition in protracted crisis situations. So firstly, in terms of what is good practice, we're seeing this in three respects, and you can relate this back to the framework which Jeremy just presented. Clearly, the need for multi-year development financing that does two things, that addresses the underlying causes of malnutrition, but also adopts a longer-term approach to meeting the chronic humanitarian needs that we find. And as much as possible through strengthened national systems. So, for example, the integration of the management of acute malnutrition into health systems and the scaling up of long-term safety nets that help people meet their immediate food needs in context of protracted crisis. The second element of financing is around supporting early action in response to early warnings of shocks and crises. So the need for contingency funding, particularly at a national level and also at a decentralized local level as well. And the third role for good financing for nutrition is indeed in terms of saving lives and meeting immediate humanitarian needs that are a consequence of shocks. And particularly in contexts where governments are part of the problem, particularly in conflict situations where governments or other political authorities are parties to conflict, and there's a real risk that humanitarian principles will not be adhered to. Next slide. In terms of the current practice that we observed in the case study countries, clearly, as Carmel pointed out at the beginning, the issue of better coordination and coherence between humanitarian and development action is not a new issue. And a lot of progress has and is being made, and we were seeing that in the 4 case study countries. And we did find numerous examples of good practice in terms of the integration of the management of acute malnutrition into health systems in Ethiopia and Kenya, and even in Yemen, where actors are working with local government health systems to manage acute malnutrition, despite it being a highly complex and difficult situation. Even though in Somalia, discussions around the need for multi-year humanitarian response plans and programs and financing didn't fully come into fruition. There are examples of where individual actors and individual donors have made that shift and are providing multi-year financing to humanitarian actors in Somalia to try and avoid the stop-start nature of programming that Jeremy was talking about. We've seen the scale-up of large-scale safety net programs in Ethiopia, the Productive Safety Net, and also in Kenya, in the northern arid and semi-arid lands through the Hunger Safety Net program. The way we also observed the way in which the government of Kenya, as part of its increasing responsibility for preventing malnutrition in Kenya, has decentralized contingency funds to district level that contributed to earlier responses to the drought 2 or 3 years ago. In Yemen, we've seen how there is substantial development financing being provided, particularly being led by the World Bank in this highly complex crisis situation, protracted conflict situation. So unprecedented levels of development financing in that kind of context. We've seen how the World Bank and the EU are looking at how to provide direct budget support in Somalia. And we've also observed how there are increasing allocations of humanitarian financing to local actors in these contexts as part of the localization agenda. So lots of examples of good practice, but it is still quite piecemeal, quite fragmented, and perhaps importantly, the range of interventions that are required are not always converging on the most at-risk populations. So development financing, when we think about what that should be doing, thinking back to the framework that Jeremy presented, is still woefully inadequate, and the response to financing is still largely through humanitarian systems and mechanisms, which are being stretched to breaking points and are perhaps filling the gap to some extent where development financing should be coming in. And as Jeremy pointed out, there are major transaction costs associated with the short-term humanitarian financing. There's all sorts of barriers that we observed and we could highlight for better, more appropriate multi-year financing that helps to prevent as well as treat malnutrition. But just to highlight one in particular, by their very nature, these situations, the capacity or even the willingness of governments to take ownership and leadership and to scale up national resources is quite limited. And by definition, there's a high dependence on the international system to provide support. But yet in donor countries, we see a real political risk aversion to scaling out multi-year, more development types of investment. And inevitably, to some extent, as the priority is given to meeting immediate humanitarian needs, the opportunity and the availability of other longer-term financing is limited. So there's a real need to make the political case for development investments in protracted crisis situations. And that case is already being made at global level, but also we observed it in the case study countries. And strikingly in Yemen, where the World Bank is taking quite a lead and is investing significant amounts of IDA in that country. And the World Bank making the case, saying that in Yemen, even though there are significant risks to the provision of IDA, longer-term development financing, we are seeing significant results from the investments that we are making. And the risk of not investing longer-term in developmental actions, in preventing malnutrition, in building local systems where we can, is so much greater than depending upon short-term humanitarian financing and actions. And also that if we don't take that risk of investing longer term, then the cost of re-engaging after the end of conflict or when the situation stabilizes is so much greater and so much more time consuming. So moving on now to thinking about, well, what are the next steps? If we're looking to address these challenges, to strengthen the humanitarian development nexus for nutrition, what are some of the actions and steps that can be taken? I'll talk first about possible steps at national level, many of which are already being taken. And finally, I'll talk about possible steps at the global level to support improved humanitarian development action at the country level. So firstly, nationally, bringing national nutrition stakeholders together. Clearly, it's difficult to develop a more coordinated, coherent response to nutrition if people are not in the same room discussing, if they're not developing shared analysis and plans together. So there's clearly a need for a common forum which brings humanitarian and development actors together, led by governments as much as possible. But exactly what the nature of that forum, those coordination mechanisms would look like, clearly depends upon the context. In some countries where there are some type multi-stakeholder platforms and humanitarian clusters, then bringing those two together for more joint dialogue and analysis and planning is a good way to go. But where there aren't those longer-term coordination mechanisms, but there are clusters, in some cases we've seen how it's possible to build upon those and bring more development actors for nutrition into the humanitarian coordination space. And as Jeremy pointed out, that one of the challenges is that for the more developmental interventions to address structural needs and structural causes of malnutrition, there's not the same clarity of leadership that might be required to ensure that scaled-up response occurs. So, bringing people together for joint analysis. What type of analysis is needed? Then clearly there's a need to differentiate between the different caseloads, between those that are experiencing protracted humanitarian needs due to structural issues, and those that are facing short-term humanitarian needs that are a consequence of an immediate shock. Clearly, that's a simplistic categorization, and there's a lot of overlap, as Carmel pointed out at the beginning, with people facing protracted humanitarian needs, but also recurrent shocks at the same time. There's a need to understand the causes of malnutrition for these different caseloads, and identify and agree on the most vulnerable populations where humanitarian and development actors will converge their actions to deliver a comprehensive response to malnutrition that addresses both those immediate needs and the underlying causes. There's a need for, perhaps in many situations, a better political economy analysis to better understand who is committed to nutrition, who is prepared to take on the leadership roles, and who has the power to make a difference. And in order to ensure that the way in which assistance is delivered is appropriate, that it's strengthening national and local government-led systems where that is possible, but also at the same time where that is not possible, ensuring that assistance is provided to those who need it most, in line with humanitarian need and humanitarian principles. And there's also a need to understand, for nutrition actors, to understand the wider development and humanitarian context, and which leads on to the next point, around the joint positioning of nutrition and joint planning. We saw the need for nutrition actors to be aware of broader development plans and processes and wider initiatives to strengthen the humanitarian development nexus in different countries and ensure that nutrition is positioned as a priority within those broader development plans and broader initiatives to better integrate humanitarian and development action. We talked about the need to agree on collective nutrition outcomes. So perhaps as a way of bridging the current divide that we see, whereby predominantly humanitarian actors are focused on addressing wasting, and stunting is seen more as a development issue. Then that political economy analysis that we spoke about earlier should then help to inform greater clarity regarding the division of responsibilities between different actors. And the final point in terms of the joint planning is that, yes, the humanitarian development nexus is important, and clearly in protracted crisis situations, we see a need for joint humanitarian and development action converging on the same populations. But do we need to be going beyond that and talking about a humanitarian to development transition, whereby, as we see a scale up in development assistance, development financing and action, it should lead to reduced risk, reduced humanitarian caseloads, and reduced humanitarian expenditure. Are we doing enough to plan for that transition and to monitor and evaluate whether it is actually happening by setting targets and indicators whereby we can track changes in caseloads, changes in spend, and perhaps even a reduction in the number of consecutive humanitarian response plans that we see. And so this is just highlighting some possible next steps at the global level, which could support those processes at the country level. A question that perhaps we can discuss is to what extent there is the opportunity for greater collaboration between the Sun movement, between the Sun Global Support System at the global level and the Global Nutrition Cluster to provide more joined up support to the country level. By the Global Support System, I'm meaning the Sun Movement Secretariat, but also the networks that provide support to the country level as well, through the UN, civil society, donors, and business. So that's the first point. The second point, as we've said, we see a clear need to make a stronger political case for development investments in nutrition in these contexts. And the Nutrition Growth to Growth Summit, where resilience in these kind of contexts is a key issue, is a key moment where that political case should be being made, not just at the summit, but in the build-up to that summit, whenever that might take place. The third issue at the global level is in terms of how the scaled-up development financing is mobilized and channeled and allocated. In the course of the work, we had a lot of discussion with the World Bank around the famine action mechanism, and to what extent there is a need for more multi-donor, multi-stakeholder engagement in that discussion around whether existing funding mechanisms can be adapted, or whether there is a need for some new trust funds, which really mobilizes and channels more developmental investments for nutrition. And the final point is, again, to some extent, a question, but is there a need to agree on if, when, and where multi-year humanitarian response plans are appropriate, and if so, to agree on what criteria are used to determine whether a multi-year humanitarian response plan is needed for a particular context.
Thank you, Chris. That's great. So I just want to close and thank you all. We've been so thrilled to see such a large number of you participating today. To welcome any one of you to be in touch with us off the back of this webinar, and indeed to visit the website if you would like access to any of the case study material. And as I said earlier, we will be publishing the synthesis paper very soon, as well as 2 of the final case studies. So thank you all so much for your engagement, and we'll also share on the website in a couple of weeks the podcast recording of the webinar, so you can listen back to the bits that you might have missed. So thank you, and keep well and keep safe in these tumultuous times, everybody. And we look forward to engaging with you again. Thank you and goodbye.